Hey guys, today I'm going to be talking about post graduation in India for foreign medical graduates. Okay, so in India we have two types of degrees. One is the MD degrees, and the other is the DNB, the Diplomate of the National Board degrees. Okay, according to MCI, both these degrees are equivalent. Okay, although people do consider MD to be superior to DNB. Okay, so for foreign medical grads, if you want to do a postgraduate medical course in India, what is the approach? I mean, how do you get in, right? So, considering that you've done your undergraduate course in a foreign country, that means you will not be eligible for state quota in any state. Okay, state quota does not depend on your domicile, it depends on where you did your undergraduate course. So, in case you did your undergraduate course in Maharashtra, for example, then you would be eligible for the state quota in Maharashtra. So, for all foreign medical grads, the only way to get into postgraduate medical course is through the All India, okay, the All India NEET score. Okay, so that's the first thing you need to understand. Now you've gone for the NEET exam and you've gotten a rank. Okay, now how do you decide which course to take or where to take it? Okay, so the general rule always is to opt for MD courses over DNB courses, right? So if you have a very good rank, for example, your rank is within the first 500, then you will be open to selection from good colleges, okay, and good fields. Okay, so the first and most important thing I think is your field of choice. Okay, you want to do medicine, you want to do surgery, you want to do radiology. And the second thing is where you do it from. Okay, are you doing it from a government college, an MD course, or are you doing it from a DNB college? Okay, so I think first preference is always given to field, and second preference is given to where you're getting it. Okay, now if you've done really well, I mean, it's quite easy. Then it's quite straightforward. You'll get in an MD course in a field which you like. Okay, but now if you haven't done the best that you could possibly, getting a rank of 4 or 5,000, well, in this situation, getting MD courses in clinical fields at a rank of 4 to 5,000 is pretty tough. Okay, it's not that easy. You will get paraclinical fields like, for example, pathology, but not something like medicine or surgery. Nevertheless, I think it's more wise to choose the field you like rather than the place where you're getting it. So you can, at a rank of 4 or 5,000, you can still get medicine in a DNB course or surgery in a DNB course. Okay, so you could probably opt for a DNB course in that case. Okay, if your rank is further behind 10,000, then I would probably say to give it another attempt, because those are, I mean, you'll only be eligible for the non-clinical or the paraclinical fields in DNB that do. Okay, so depending on your rank, you can get your choices as where do you want to go. I mean, what field do you want to do? Okay, so now MD courses are conducted in government hospitals, okay, whereas DNB courses are conducted in private hospitals. Okay, so there are certain pros and cons of each. In government hospitals, since it is the government funded treatment is very cheap. You have a huge amount of patients. Okay, so you get a lot of patients, you get a lot of variability of disease and a lot of variability in severity of diseases, which you're going to get to see. So you get a lot of exposure, but there are cons also. In MD courses, basically, patients are not that affording. So, especially in fields like medicine, you won't be able to use the more advanced treatment regimens, which aren't provided by the government, but rather that the patient would have to buy himself from the chemist for medications and things like that. On the other hand, in DNB hospitals, they have patients who are much more affording and are willing to pay the extra money to get better medications, and so you get used to using such medications also. Okay, but on the flip side, in DMB courses, you have lesser patients as compared to MD. You have lesser variability of cases. Okay, there's not too much difference in fields which are non-surgical like medicine, pediatrics, among MD and DNB. But when it comes to surgical fields, there is a more significant difference, and the reason for that is because in government hospitals, you get much more uh, hands-on cutting and operations as compared to that in DNB hospitals, which is understandable because you have these private patients who are paying consultants to be operated by them. So you get to rather assist or do the post-op stitching and closures rather than doing the whole operation by yourself. So if you're opting for the surgical field, try and get into an MD course. But if you're opting for a medical field, if you're not getting an MD course, a DNB course is good enough. For people who are not getting a surgical field in an an MS course, a surgical field, you can still go in for the DNB surgery course, and after that do a year or so in a government hospital, and you'll become at par with the people working in government hospitals. So these are some pros and cons of MD and DNB, and prepare hard if you want to get any of these courses